What is the relevance of hepatic microsomal enzymes in toxicant metabolism? Hepatic microsomal enzymes, especially the cytochrome P450 family, are central to phase I metabolism of many toxicants. They oxidize, reduce, or hydrolyze xenobiotics to prepare them for conjugation. For example, the metabolism of insecticides like permethrin in dogs relies on these enzymes. Breed-related differences, for example, in collies, or enzyme inhibitors can drastically change how a toxicant behaves, either delaying detoxification or enhancing toxicity. What is biological monitoring in relation to toxicokinetics? Biological monitoring refers to measuring toxicant levels in biological matrices like blood, urine, hair, or milk to estimate exposure or body burden. For instance, lead levels in blood and bone are monitored in calves near industrial areas. This practice is vital in occupational veterinary settings, for example, pesticide exposure in dairy workers or lab technicians, as it helps assess chronic or subclinical exposures based on kinetic data. How do non-mammalian species differ in toxicant kinetics? Birds, fish, reptiles, and amphibians have unique anatomy and physiology affecting toxicant ADM. Birds, for example, have high metabolic rates but limited detox enzyme systems, making them more sensitive to organophosphates. Fish absorb waterborne toxicants directly via gills, bypassing first-pass metabolism. These interspecies differences demand caution in extrapolating doses and require species-specific kinetic data for accurate assessment. How is time to steady state calculated and why is it important? Time to reach steady state in repeated exposure is typically about 4-5 times the plasma half-life of the compound. For instance, if a drug has a half-life of 10 hours, steady state is reached in 40-50 hours. This is crucial for chronic dosing regimens such as with phenobarbital in epileptic dogs, ensuring therapeutic levels without accumulation toxicity. It also informs timing for residue testing in livestock. What factors influence dermal absorption in animals? Skin thickness, hydration, species, site of application, and the chemicals lipophilicity affect dermal absorption. Cats, with thinner skin and grooming behavior, are highly susceptible, making pyrethroid spot-on treatments dangerous. In pigs, thick skin reduces absorption, but cuts or abrasions can increase permeability. Formulations like alcohol-based carriers also enhance dermal penetration. Why is it difficult to estimate bioavailability in poisoned animals? In poisoned animals, vomiting, diarrhea, altered perfusion, or GI stasis may affect absorption unpredictably, making bioavailability estimation unreliable. For example, an animal poisoned with bromethalin may vomit soon after ingestion, reducing absorption, but the exact dose absorbed remains unknown. This uncertainty complicates prognosis and antidote calculation, necessitating supportive treatment based on clinical signs rather than dose. What is allometric scaling and how is it used in toxicology? Allometric scaling uses mathematical models to predict how animals of different sizes metabolize drugs or toxicants. For example, clearance and volume of distribution often scale with body weight raised to a specific power. This is used to estimate safe doses for exotic species like elephants or birds when no direct pharmacokinetic data are available. However, physiological differences limit the accuracy of such scaling, especially for non-mammalian species. What is toxicokinetic pharmacodynamic (TKPD) modeling? TKPD models link toxicant concentrations, kinetics, with biological effects, dynamics. For example, modeling fipronil exposure in birds not only predicts how much accumulates in fat and liver but also how it affects neural activity and mortality. These models support regulatory decisions by predicting real-world outcomes from laboratory data and guide clinical interpretation of blood toxicant levels. How does particle size influence inhalational toxicant absorption? Smaller particles, 2.5 m, reach the alveoli and are absorbed into the bloodstream, while larger ones get trapped in the upper airways. For example, mycotoxins or ammonia gases in poultry houses can penetrate deep into the lungs, causing systemic and respiratory effects. Masking, ventilation, and particle filtration are essential in occupational and animal housing settings to mitigate this risk. How can PBPK models predict interspecies residue risks in food animals? PBPK models simulate how a drug or toxicant distributes in organs like liver, kidney, or fat in different species, helping set withdrawal periods. For instance, sulfamethazine clearance is slower in swine than in chickens, requiring longer withdrawal in pigs. By adjusting physiological parameters, like liver blood flow or tissue partitioning, the same model can estimate residue depletion in cattle, goats, or fish, ensuring food safety across animal products.